I can tell you you've helped me, and I believe in that. You've helped with the education side. I mean, it almost goes into a whole, like I said, a whole nother list of questions. But what I'm gonna do is I'm gonna put some of these links in. Sure there's gonna be a lot of questions, and if it's all right with you, if I have some of our viewers that have some questions, if I can forward them on to you.
You can not only forward them on, but we have a telephone number. It's 480-833-2232. They can call the desk, ask their questions, write them down. I don't go to my emails, okay, because I get so many emails a day that I have to erase 60 or 70 emails, and I would hate to erase somebody's email.
Yeah.
But if people become patients of mine, they have my cell phone number.
Yeah.
And they can text me.
Yeah.
Texts are much better.
Yeah.
But the thing is that I try to be available. Drives my wife nuts.
Yeah.
But she's a good person, and she's seen what we have been able to do for other people. So when I first met her, I asked her who her dentist was. And she looked at me, she says, well, I go to this doctor. I said, how many root canals do you have? She looked at me, said, what do you mean? Let me tell you, what happened was you had a little cavity, right? And he says, we got to fill that right away. And then he prepared the tooth. And then he put a white filling in there, right? And then 3 months later, you started hurting so bad, you called him as an emergency patient. They got you in right away, and he started a root canal, right? And then after the root canal was done, he sold you a crown. Is that correct? And she said, how did you know? I said, when you put a white filling material in, you put a liquid on top of it. Now, we used to use an acid and then a filler. They now have where there's an acid and a filler, and when you put a light on it, it stops the acid from working, it converts the material, and now it can grab into the enamel and hold a physical hold. And then they take filler material that chemically bonds to it, and now you got your filling. So what he did, he drilled it so it got real close to your nerve, but didn't expose it. He put that stuff on there, and then he put the other stuff on there and then hit it with a light. The stuff was never deactivated. And within a few months, no more than 4, you're begging for a root canal. So she looked at me and says, why don't you turn them into the board? How could you let something like that happen? That, I guess, is acceptable dentistry.
Mm-hmm.